So I want this to be more of a discussion than a lecture, because it's too sensitive a subject. To start with, we'll talk about the definitions of the different words, because people throw around living wills, advanced directives, CPR, code blue, and words like that all the time. And I think most people don't really know what they mean. We'll talk about the components of a living will and some of the concerns families and patients have regarding those very tough decisions. We'll also lastly talk about what barriers there are, why people may not fill out a living will, or why people may fear filling out a living will. I'm curious, anybody here, if anybody here has had a CPR class? So actually a decent number of people here have been through a CPR class. How many people here have actually had to resuscitate a patient? Not too many of us. I will be saying stuff that I think you two remember very non-fondly. The one most vivid memory I have of my residency is when I was an intern in the intensive care unit. A code blue, which I'll define in a minute, was called. That means someone's dead. And I had to respond. And as a small person, I had to climb up on the bed. And this is going to be gory, so anybody who doesn't have a stomach for this, please forgive me in advance. I had to climb up on the bed and perform CPR from a decent height. And under my hands, I felt my patient's bones break. Under my hands. That's the goriest thing I'm going to say. But it's pretty awful that that's one of the most vivid memories I have of residency, and I'm sure other physicians have similar experiences, unpleasant experiences. It's a horrible feeling to feel that. It's a horrible feeling to do something that you feel is futile, that is medically unnecessary, or medically futile. No reason to do something, but we'll go into that. What is CPR? First, cardiopulmonary resuscitation is the maneuver, the action of compressing the heart from above in order to squeeze the blood in and out, while at the same time providing respirations through mouth to mouth. From there, people that survive this initial cardiac arrest, cardiopulmonary arrest, if they survive it, they usually end up in an intensive care unit on a respirator, the tube put down the throat into their lungs to breathe for them, and on 1 million monitors, tubes in every orifice, and sometimes with no brain function anyway. Sometimes when we perform CPR, there isn't enough blood pumped to the brain that there is in a normal situation. I mean, the body knows exactly how much blood needs to be perfusing the brain, but CPR is just a stopgap measure. It's just trying for the minute to get people to stay going. But there is a tremendous proportion of people who don't come out of that with any decent brain function. Sure, there are some. But if the person who codes has the code blue, has a code blue in the first place, we're not dealing with someone who's healthy for the most part. There's the occasional young person who perhaps, God forbid, chokes and needs a Heimlich maneuver and then ends up on a respirator for a little while. That's not the kind of stuff we're talking about. We're talking about end-stage disease. So the person who is dying before us, it's not like there's good health to come back to. They coded for a reason. And the code blue means essentially someone's dead. And in a hospital setting or any other setting where a patient doesn't have a living will, a code blue will be called. Cardiopulmonary resuscitation will be initiated, and if the patient survives, they'll end up in an intensive care unit or emergency room setting. presumably on a ventilator. Not fun. Not fun on either end, I'll tell you that. So a living will is the same thing pretty much as an advance directive. The living will simply also has a part where you can say who is going to be your power of attorney for health care, meaning not the person who's the executor of your will, but this is the person who essentially is in charge when you are very ill, when you're unable to speak for yourself. Those are the people that stand up for you and say, we'll make these decisions, we'll make those decisions, and presumably they're a close person to you who knows how you feel about end-of-life issues. We'll get into that a little more. So there's the power of attorney for health care, choosing either a family member or a close friend, vital to have that because that person's advocating for your wishes. The parts of a living will that we talk about are 3 end-stage conditions. Okay, we're not talking again about young people or sudden things going on. We're talking about people who are dying of an end-stage condition, have a terminal illness, or are in a persistent vegetative state. Persistent vegetative state, everyone unfortunately is familiar with because of all the things that have gone on in the last few years. It's someone with essentially no brain function left whose body's still working. And they get total care for everything. They can't do anything for themselves. They can't even move much of the time. So those are the 3 circumstances that we think about when we fill out our living will, if we fill it out at all. The directive itself tells the world what you want to be done to you or for you when you can't speak for yourself. So an example would be someone who has such severe heart disease and congestive heart failure that really they're at the end stage of an illness, or they have terminal cancer, or, God forbid, in a persistent vegetative state. In that situation, you want your beliefs and your philosophy about your life, your health, and your death to live on, even if you can't speak for yourself. And your power of attorney for health care is that person that advocates for you. Now, presumably, your doctor should be your greatest advocate, but the people around you need to know how you feel about certain things. What's your philosophy on going on a respirator if you're terminally ill? What is your philosophy regarding tube feeding, which we'll get into in a minute? What's your philosophy regarding going to the hospital at all anymore? Someone who's been through several years or months of chemotherapy, and they go to the hospital and they come back and they go back for more chemotherapy and then they come back. It really does grate on you after a while, and not everybody wants to continue doing that, depending on what the likely outcome is going to be. I'd like to introduce some realism here for everyone, because I think that many of us are unrealistic when we think, okay, the person passes, the person dies, they're brought back to life by CPR, and then they wake up in the intensive care unit and get taken care of and go home. Very uncommon, very uncommon.